Thank you to Ethel for inviting us to do this. We're delighted to be here. What a challenging 12 months it has been. What a journey. And it's still ongoing, because not only did we have a new regional director with a vision that had actually been set before COVID started, because he had carried out a tour of the 53 member countries, and listening to them, he had a very good insight as to what the health challenges facing the European region and its diversity are. And then COVID happened and continues to happen. And in a way, this pandemic has, to use a pun, really unmasked some of the critical challenges that health systems have been facing. It also, in terms of what the priorities had to be for the coming years, and actually showed that our plans were very much on track. Where are we now? We are now, of course, in the midst of a ferocious and devastating pandemic, which has had huge impacts and effects. But there are some opportunities, because in times of greatest adversity is often the time when huge innovations come through. And I think this is very much what we are seeing in the digital health area and arena. And I think we have a small window of opportunity to strike whilst the iron is hot, to ensure that we really keep those innovations and changes that are working and that have an impact, whilst at the same time recognizing the limitations. So, of course, what have we seen? We have seen a huge disruption of traditional modes of care provision. We have seen a dual track health service response kick in, not to the extent that we would have liked it. What do I mean by a dual track? I mean that on the one hand, health services were trying to adapt, to surge to their COVID response, to innovate. On the other hand, they were trying to keep as far as possible routine activities from being disrupted in a major way. Of course, disruptions did happen, continue to happen, and we are going to have to recuperate and recover in the coming months, and the effects will be felt for a long time. It has exposed significant weaknesses in our ability to have access to valid, credible, and near real-time data for understanding the spread of COVID-19. And never forget that the virus is always ahead of where we think it is. So even hours make a huge difference. In terms of the health workforce and equipment allocation, early on, the mapping of where the gaps, for example, in equipment and ventilators were, in PPE were taking place. But now we know that the critical shortage and bottleneck is the health workforce, and we still don't have access to reliable, credible, comparative, real-time data on where these gaps are. And so the ability to calibrate our health system response, targeted in a very responsive and finite way, has been somewhat hampered. And the need to accelerate the implementation of digital technologies that will allow us to have this better access, of course, I think has really been underlined. But we have seen a large array of digital health services employed during the past months. And for some of us who have been involved in health systems for the past 2 decades, sometimes really going against the current to try to implement and scale up digital innovation, I think we saw transformations and changes happening that we would have never imagined possible within such a short space of time. So, for example, we've seen the deployment and implementation of several applications around tracking, surveillance, forecasting, digital contact tracing. What we really need to know, however, is not only about the deployment of these applications, but about their uptake, about the trust, and about the ability that they have had to make an impact on transmission of the pandemic. And that is work that is really important and that we look forward to carrying out in the coming weeks and months. In terms of diagnosis and diagnostics, symptom trackers, remote monitoring of persons who are infected but who are not that unwell that they had to be admitted into hospital, lots of domiciliary monitoring. And then AI-powered CT imaging, for example. And of course, the ubiquitous temperature-based diagnostic identification, not only for border controls, but also in many public places now. Of course, there is a debate as to, again, these have been deployed, but what is the real impact? And then managing contacts with the health system, telemedicine, teleconsultation, a lot of triage, chat services and chatbots, as well as rapid rollout of e-prescription services to make sure that access to essential medicines could be maintained. Not to talk about simulation tools to try and really adapt and forecast the surge capacity, e-learning platforms, and then also automation, robots in ITUs, accelerated testing regimes, the AI support for clinical trials. The world has never been so fast and so close to produce effective vaccines. And we know that technology has played an important role over there. And now we're talking about certification, for example, digital immunization certification, something that many of us in the health systems have wanted for such a long time. And it could be that it has taken a COVID pandemic to get us nearer to achieving this goal. So plenty has gone on. And what we have seen is that COVID has definitely removed some of the major barriers to adoption and has shown us the need to have this consistent and measured health system response. We need information to know where the virus is spreading, but also which population groups are the most vulnerable and how we can better protect them. We need consistency, and what we saw sometimes was a lot of inconsistent practices across the region, and we need to better be able to monitor and measure, and we now need to go also into impact measurement. So there is some reason to be optimistic in the forays that we have seen in the digital technology field, but the health data landscape of today has a long way to go. There still are lack of meta standards, delays in receiving data across the region, particularly when we move out of the EU. We find still a lot of suboptimal health information architectures, persistent silos, the lack of health data governance and guardianship comes through, and the capacity of people who can actually deploy, implement, and utilize this. Early on in the pandemic, it was Easter time. I remember because it was Easter weekend when I was working on this. We worked on a framework for countries to be able to transition through the pandemic. We knew at the time that there would be a time when things would get better and then things would get worse again. So we saw this coming, and we said to governments and health authorities, look here, you're going to have to keep 4 areas very much on your dashboard: the public health and epidemiological considerations, the R factor, the mortality, the incidence, all of that. Your dual track health system, but not only, you need to monitor all the time the way in which your population is engaging, responding, and acting on the information that is being provided, because that is really key. And over here we are seeing also that over 20 countries across the European region are implementing longitudinal, what we call behavioral insight surveys, to have this feedback loop all the time that allows them then to fine-tune their response and their communications. And of course, we need to keep an eye on the social and economic implications, because some of the collateral impacts of the measures that have been put in place to control disease transmissions have significant and profound health implications. And at the heart of this, there must be data and digital solutions. And this is the kind of dashboard that we are promoting. But of course, we know that there are frontiers and limitations. Digital solutions do pose risks to widening inequity gaps and uneven distribution of benefits. Individuals can be shut out, countries can be shut out, the individual's ability to navigate this new terrain. And I think when, for example, we come to see domiciliary telemedicine consultations that have become so popular among certain segments of the population, but have left others behind. And we saw this, for example, also with the shift to distance and online learning, which in some countries was rolled out relatively quickly, remarkably, but there we saw that children in certain socioeconomic groups were far more likely to continue learning, whilst others were being left behind. And we do think that there could have been, however, some missed benefits that we haven't yet capitalized on, including, for example, the improved self-management of long-term conditions and the time, convenience, and cost saved. I mean, when we're trying to combat a pandemic, the last thing that you want to see is a crowded waiting room in a hospital outpatient building. Will we see those images again when the pandemic is over, or have we crossed the threshold and beyond which we won't go back? So I think strengthening digital health has clearly become a key priority, not only for WHO, but for all our European member states. But we want to do this in a way that decreases inequities, accelerates reform, leverages untapped potential of data, and empowers individuals and communities. And to do this, digital health is one of 4 identified flagship areas. And we are launching the digital health flagship this coming year. We shall have a European roadmap. And again, the focus here is going to be on safe, inclusive, and people-centered services, on strengthening health security, and on leveraging technology to support the transition from reactive care to preventive health. And to do this, we need to empower people and the health workforce. One of the first things that we are working on is a charter of European values and principles for governance and utilization of health data. And of course, we are very small. And the only way we are really going to be able to bring about the transformation that we would like to see is through working with others, empowering patients, empowering healthcare professionals, and ensuring that we have the appropriate enabling environment is going to be key. So in conclusion, increased societal resilience through digitalization is possible if we observe a delicate balance. We recognize the role that these solutions can play, but we need to make important and conscious choices to ensure privacy and even distribution. And of course, good health and well-being depends on well-governed health systems that facilitate the flow and use of information and transparently to citizens. We can't build without having citizens' trust. And our engagement is going to be focused on the implementation of digital health, which is guided by ethically and morally responsible principles and affordable solutions, because we can't have this only for either the rich or the high educated, or also have a huge country gap. So to summarize, COVID has triggered several disruptions to the traditional model. We've seen rapid change and large scale up of innovation that have overcome old and long-standing barriers and challenges. So there is a window of opportunity to move forward. In doing so, we need to analyze the effects of digitization, what has worked well and where it has failed, to cement and mainstream the digitalization for what works, but to recognize the limitations and the frontiers. And we are calling for action for the health policy priorities, and we will do this through our digital health flagship, and we will very much look forward to working with you, Ethel, as a long-standing partner and stakeholder. Thank you.